Welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining me again today.
Of course, thanks for having me.
Absolutely. My name is Dilshad Burman. I will be moderating this chat today. I'm a writer and reporter with City and 680 News. The way this works is we've been collecting your questions over the past week for the doctor, and we will present them to her today. She's never seen them before. All of these answers are off the cuff. And if you haven't had a chance to submit your questions, you can still do so under this live broadcast, and we'll try to take as many as we can in this short 30-minute period that we have with the doctor. So we're going to start today, once again, with vaccine questions because they are top of mind for most people. And after that, if we have time left, we'll get to the other questions. But again, please submit your questions live. We'll try and get to them as well. Doctor, are you ready to go?
Let's go.
All right, let's start. This week, we're going to start with Graham. Graham asks, how long after my second Pfizer shot should I wait before having my second Shingrix shot?
Okay, so we recommend that if you get a COVID vaccine, wait 4 weeks before you get another vaccine. And so you would wait 4 weeks before you can get your Shingrix shot.
Okay, perfect. And then this one is from Anonymous. I have heard that the vaccine causes severe nosebleeds and has also led to miscarriages in some cases. Is this true?
So first I would ask Anonymous, where are you getting your information from? I think we're hearing a lot of things. The question is how much of it is true. And nosebleeds are not linked to the vaccine. Neither are miscarriages. The piece on miscarriages actually has been well studied, continues to be studied among people who are pregnant who get vaccinated to make sure that the rates of miscarriages are not higher among the vaccinated groups, and they have not found that to date.
Okay. And then Norma asks, along with others that I know in the 65 to 75 age group, I received 2 doses of AstraZeneca with no side effects before NACI changed the guidelines. Since then, we've all heard that mixing and matching offers a stronger immune response than just 2 doses of AZ. As we are in the vulnerable category, will we be offered an mRNA booster in the fall?
Okay, so I want you to know that 2 doses of AstraZeneca is still a very, very good schedule, and it still is recommended. I mean, part of the reason for recommending mRNA for that second dose is actually to reduce the risk of those severe blood clots. That's part of the rationale, a big part of the rationale. So 2 doses of AstraZeneca, we know, will give you very good protection against being hospitalized, getting severely sick from COVID. There are no recommendations right now in Ontario, in Canada, for a 3rd dose, a booster dose. This is certainly something that we're keeping an eye on based on the data, but right now there's no suggestion that because you got 2 doses of AstraZeneca, you need a 3rd dose of a messenger RNA vaccine. But if the guidance changes, if the evidence changes, then that recommendation will change as well. But there's no evidence or to suggest that that's the case right now.
Okay. And then Nadir asks, when will Ontario change the screening questions, particularly the one related to traveling outside Canada in the last 14 days? Sorry, this is not a vaccine question, but it snuck in there.
That's okay. No, actually, it's related to vaccines. So actually, some of those screening questions have changed. They are continuing to change as the guidance changes. So one of the screening questions is, for example, if you have a headache and are feeling slightly unwell within 48 hours after vaccination, you can still go to work. So that has been changed. Related to travel, if you've traveled in the last 14 days but have had 2 doses of vaccine, and meet the criteria from the federal government for not having to quarantine, then you won't need to quarantine. So that has been changed on the screening questionnaire to date, yeah.
Okay, and then doctor, when it comes to quarantining upon arrival, I saw this, we had a question that came in on Instagram actually. Somebody said that they were vaccinated and then they traveled, but they didn't wait the 2 weeks, so like the vaccine hadn't kicked in, and then they came back to Canada. And basically they were considered unvaccinated because they didn't wait the 2 weeks for the vaccine to kick in. So is that something that we're seeing?
That's right. So you have to be fully vaccinated, and fully means 2 doses at the right interval, so at least a month apart, with 2 weeks after the second dose. And then you're considered fully vaccinated. So it's 5 days after the second dose, you're not fully vaccinated. You're just considered vaccinated with 1 dose, and you will have to quarantine for those 14 days.
Okay, that makes sense, because I think a lot of people are like, oh, got my second jab, I'm off on a plane, and then you don't realize that you're not considered fully vaccinated unless those 2 weeks have passed. Okay, good to know.
That's right. Yeah, good point.
Right. And then, okay, we've got a live question coming in here. Marlena asks, if you're fully vaccinated, do you need to be tested for COVID prior to traveling?
You'll have to follow the guidelines and recommendations with the airline and the place that you're going to. My understanding is that, yes, for many places, even if you're vaccinated, you're still required to show a negative COVID test.
Right. Okay, and we'll go back to our
actually, maybe it's even worth saying, even if you return to Canada and you're fully vaccinated, don't have to quarantine, one of the reasons for not having to quarantine is to be able to produce a negative result as well.
Okay, good to know. And then let's go back to our submitted questions here. Phoebe asks, and this is quite a few questions in this regard here. Do you think Health Canada will eventually consider adding other vaccines to the list of Canada-approved vaccines? My friend, who is a Canadian citizen, has been stuck in Cuba and is considering getting vaccinated with the Cuban COVID vaccine. Will he need to be revaccinated when he returns to Canada?
Okay, so actually that recommendation is not from Health Canada. It's very confusing, but the recommendations for which vaccines you need to be able to not have to quarantine, which is those Health Canada approved vaccines, that recommendation actually comes from Border Services. Okay. And so there are an awful lot of recommendations for different kinds of things that you're doing. And so, yes, there is a possibility that Border Services may change that in the future, but it's currently their recommendation for only Health Canada approved vaccines that enable you not to have to quarantine. Now, it's not, though, that if you've got 2 doses of a vaccine wherever you are and come back to Canada, and you're eligible to come back to Canada because you're a Canadian citizen, it just means you will have to quarantine. But it doesn't mean that you won't be able to come back.
Technical difficulties when you're live, right? It happens. So, okay, here we go. Let's go back to Maria's question. Maria asks, can you come into Canada with the Sinovac vaccine, or will you have to quarantine? And the same goes for Fadia, who asks, is the Sinopharma vaccine recognized?
Okay, so there's a number of ways. This is very similar to the last question. You can still come to Canada if you're eligible to come to Canada, and that's being a Canadian resident, for example. In the future, if you're an American resident, you can as well. It's just if you do not have a Health Canada approved vaccine complete schedule, you will have to quarantine for the 2 weeks. And those 2 vaccines that were listed are ones that will require you to quarantine.
Right. Okay. And then Stretch asks, my fiance has been stuck up here for over a year, I'm assuming in Canada, and now is being told that she still can't cross the border because she hasn't been vaccinated yet. How can she get vaccinated in Canada?
So actually, anyone is eligible to be vaccinated. You don't need a health card to be vaccinated. If you're in Ontario, you can go to a pharmacy, you can go to a vaccination clinic. Many vaccination clinics actually allow walk-ins as well too. So it is very easy to get the vaccine, absolutely.
Okay. And then let's go to Suzanne. Suzanne says, what is being done if we have had 2 AstraZeneca vaccines as advised, and now we can't travel to the US? Do you see that changing? Is the government working on getting AstraZeneca recognized for travel to the US?
Okay, so my understanding actually is that the US doesn't have any vaccination requirements for entry to the US. We heard a lot about AstraZeneca, and that was related to one particular concert, actually, where if you had AstraZeneca, you couldn't attend that concert. But the last I checked, my understanding was that traveling to the US, there's no vaccination requirements. There's no quarantine requirements either. There may be testing requirements. And so that 2 doses of AstraZeneca will not preclude you from going to the US.
Okay, that's good to know. That's been a question on a lot of people's minds regarding crossing the border, for sure. And then this person's alias is Dragon King. Dragon King asks, are we allowed to have more than 2 doses of the vaccine?
Right now, no one is being recommended to have more than 2 doses of the vaccine. In a very small number of countries, they're considering giving a 3rd booster dose for people who, for example, have a weakened immune system. They may not have developed a strong immune response to the 2 doses. But beyond that, no one is recommended a 3rd dose, and certainly no one in Ontario.
Okay. And then let's see. Okay, Simon asks, and this is, sorry, doctor, we've lost your video. Oh, here we go. Okay.
Oh, sorry.
No worries. So Simon says, I had a terrible reaction to my Pfizer vaccine. My feet and hands went numb. They started itching and then they hurt. It kept me up at night for several days until they gave me restless legs medication. My lip also swelled up and I developed canker sores in my mouth. I saw 3 different doctors. Nobody could tell me if this would happen again with my 2nd dose. And so my reaction was far from normal. It was actually neurological. How do I know that my 2nd dose will not give me permanent damage for the rest of my life?
Okay, so I'm sorry that you had symptoms after your vaccination. I think it's important to make sure that you report that to public health. So wherever you live, you should have yourself and your doctor make a report so that this can be investigated. And then often there will be a recommendation that you follow up with a specialist to get expert consultation on what to do about your 2nd dose. There are many allergists who are vaccinating people who have had anaphylactic reactions to some of the ingredients in the vaccine and are safely being vaccinated under controlled settings. So there are certainly ways to be able to get your 2nd dose safely if that is recommended. But I would recommend that you see a specialist to get that assessment done.
Right. This is, in terms of having done these Q&As for so long, this is the most severe reaction that I've heard of. So that's definitely something to get checked out. And then we've got a live question coming in here. We just spoke about allergies, actually. So Jason asked, what if you're allergic to the vaccine and a doctor tells you not to get it? What are your options then?
So your options are to see an allergy specialist, actually. So until an allergist actually says to you, you cannot be vaccinated, I would not assume that you can't be vaccinated. As I just said, there are allergists in our province who are vaccinating people who have had severe allergic reactions to the vaccines and are safely getting vaccinated. Sometimes they can do like give you a very little bit of the vaccine, make sure you respond to that. If you do, give you more, vaccinate under controlled settings, maybe give you medications before you get the vaccine. It's all very individualized. And so I would definitely recommend that you follow up with an allergy physician, an allergist.
Okay. Okay, and then another question from Marlena, actually. Can you explain COVID arm, in quotes, COVID arm?
I think what this is referring to is after the messenger RNA vaccines, in particular the Moderna vaccine, about 1 to 2 weeks after the vaccination, you can get a really swollen, painful arm, and that's related to the vaccination. It's not an infection. It's perhaps part of the immune response, and it's been identified, but actually goes away on its own and is not a reason not to get the next dose. In fact, if you had it with your 1st dose, you're less likely to get it as severe with your 2nd dose.
And doctor, is there any treatment required? Do you have to do anything, or can you take painkillers if it hurts?
Yeah, you can just treat the symptoms. Sometimes it's important to make sure that it's not an infection. Sometimes they can look like an infection, but it's actually not. It's just a delayed immune response to the vaccine.
Okay. And let's go back to our submitted questions again. Samantha asks, I have been suffering from severe vaccine side effects and it seems like no one will listen to me. Is there no help for people who get severe vaccine side effects?
Okay, so if you have a side effect from the vaccine, it's important to report it to public health. I think part of what we have to recognize is we have to try and tease out what side effects are caused by the vaccine and what side effects can be caused by other things. When we're vaccinating millions of people, after the vaccine, things are going to happen. People are going to, you know, break an arm, have a heart attack, get an allergic reaction. And we have to be able to decipher how many of those things are caused by the vaccine or maybe related to the vaccine. But regardless, unless we report them, we won't be able to assess it and to give you specific and individual advice.
Right. Okay. And then we have a live question coming in from Subramaniam, and it was also, in fact, our next question coming up in our cache here from Lo. Is it okay to mix different vaccines, whether mRNA or otherwise?
Yes. So, I mean, the most important thing is that we actually get 2 doses of vaccine as quickly as possible. And the reason for that is because we want protection against the Delta variant. We are seeing now Delta, we knew this was going to happen. It's making up a larger proportion of the cases in Ontario. So while the cases overall are kind of low, most of the cases are Delta. And so even one Delta case can end up spreading to 5 or 6 other people. We're also seeing in the US where they actually didn't talk about Delta a few weeks ago, and now it's all about Delta. And so that's why we need 2 doses of any vaccine. We know that 2 doses give you the best protection. 2 messenger RNA vaccines can be interchanged. I don't like to use the word mixing because we know from studies, from data, from vaccine science that getting 2 doses of any messenger RNA vaccine is acceptable, it's good, and will give you that best protection against the Delta variant.
Right. Okay, more live questions coming in here today. Let's go to Daniela. She asks, are children 13 years old recommended to get the 2nd shot of the vaccine?
Yeah, actually 12 years and up, you're recommended to get that 2nd dose. There is a small risk for that myocarditis, pericarditis, especially in males, in young males. The risks, though, are low. It's not as common. Men or young men who get, that heart inflammation, it tends to be actually quite mild. I've actually seen someone having this following a dose of a messenger RNA, a 21-year-old male, mild symptoms of chest pain, treated with just anti-inflammatories. There were no other signs of any other problems to the heart. And the benefits of being fully vaccinated against COVID, especially the Delta variant, outweigh these risks. So yes, a 13-year-old should get that 2nd dose. Okay.
And then continuing with questions about kids, actually, Morgan has another question. How do we keep children who are not eligible to take the vaccine safe? If I'm double vaccinated, can I still spread it?
You're less likely to give someone COVID if you've had 2 doses of the vaccine. But as you note, I mean, there are many children 0 to 11 years of age. That's about 11 or 12% of our population who can't get the vaccine. And the best way to protect them is to have everyone around them who has close contact with them to be vaccinated. So that's more than just parents. That's caregivers, friends, family members, as much as possible. It also means that our children should, when they're indoors, consider wearing a mask. We should maybe wear a mask when we're around others who may not be vaccinated to help protect those children.
Right, absolutely. And Dr. Actually, that brings me to another question that I've seen going around on the internet regarding schools, because children will be back in school this September. Like you said, 0 to 11 cannot be vaccinated. So is it mandatory then for school staff, teachers, anybody interacting with these children to be fully vaccinated, or will it be made mandatory?
So the Science Table and the Ontario hospitals just released their guidance for back to school recommendations, and there will be more recommendations coming from the Ministry of Health, from Ministry of Education. So we'll have to see from them what kind of guidance comes out. We actually don't have vaccinations mandatory for anyone right now in Ontario. The closest we have is in long-term care homes where staff are required either to be vaccinated or to have an education session and to sign something to say that they choose not to be vaccinated. There's no question that the more we can get everyone, like our population rates the highest, right now we're at about 80%. If we can get that to 90%, that means there will be very few people who are left unvaccinated. But it also means that we are going to have to rely on things like wearing masks indoors, keeping a physical distance when we can, staying home when we're sick to help prevent the spread of that Delta variant, especially, in that elementary setting, for example.
Right, absolutely. Okay, and then let's go back to some live questions here. Shante asks, is it okay to take ibuprofen or Tylenol if you are feeling general pain or discomfort in your arm after taking the vaccine shot?
Yeah, so in general, over-the-counter medications are fine to take following vaccinations. They won't impact your immune response. You'll still get that immune response, and certainly they will help you with your symptoms. So if you're able to take them, that is certainly an option.
Okay, and then one more live question here before we go back to our cache. Young asks, what happens if we have mixed vaccines, Pfizer and Moderna, because we may not be cleared by some countries to travel? So I think the travel question regarding mixed vaccines, we've been talking about a lot, and I believe you had mentioned that Canada is working with other countries to see that it's recognized.
Yeah, and it's not clear to me that if you have 2 messenger RNA vaccine doses that won't be recognized. I mean, certainly every country is able to develop their own policies, just like Canada has, right? But I know a lot of people have worried about going to the US, and the US actually recognizes that if you have 1 dose of a vaccine, get the one that's available to you if you either don't know what your first dose was or it's not available. So they even have that provision, and they don't have any requirements for particular vaccines even going to that country.
Right, okay. And we'll get back to our submitted questions here. We have a few more minutes. Riz asks, speaking of travel, Riz asks, is it okay for someone fully vaccinated with 2 doses to go cruising and partying for a week on board of a cruise ship without any worry of infection?
Riz, thank you for being double vaccinated, and glad to see that you want to get out, on a cruise. That risk of COVID is going to be always there now. I think we recognize that COVID is here. We know it's going to be here in the fall. It may be a new virus that we have every year, just like we have the flu. So I don't think there can ever be zero COVID risk, especially when you're traveling, when you're mingling with all kinds of other people. And so as much as we can, we want to then still take some precautions as much as we can where we're going. It's also going to depend on the COVID rates where we're going. Like we're seeing in some places of the US where COVID is actually really increasing quite rapidly. And even if you're double vaccinated, the vaccines are not 100%, and there is still a small chance that you could get COVID. In those situations, if you got COVID, you would probably be less sick. So we have to keep all these things in mind.
Right, absolutely. And you don't want to get COVID on a cruise ship. That would be terrible. You'd be stuck there for however long the cruise was. All right, let's move on to Ina. Ina asks, having had the double AstraZeneca shots, should I stay hunkered down until further guidelines are determined?
Just because you had 2 AstraZeneca vaccines does not put you at higher risk for COVID. You are still fully vaccinated. You are protected. If you have a weakened immune system, regardless of which vaccines you had, you're going to want to take those extra precautions, like wearing that mask and not socializing with a lot of people, especially in indoor settings. But with your 2 doses of AstraZeneca, you can follow the public health rules and guidance that's available for outdoor gatherings, indoor gatherings, grocery shopping, that kind of thing.
Right. Okay. And then Marlena asks, what are the rules regarding traveling with children under 12 with fully vaccinated adults?
So it depends on where you're traveling, but my understanding is that children who are under 12 who can't receive a vaccine are considered unvaccinated. And so when they return, they will have to quarantine for those 2 weeks. And so I think that's an important point for parents to recognize. They may be able to go back to work, but their children will have to stay home.
Even though they're not eligible for the vaccine at all, they're considered unvaccinated.
That's my understanding of what's required right now. Yes.
Right. Okay. Another live question coming in here about the 2 doses. Robert says, NCL Cruise Line will not recognize mixed doses as fully vaccinated. Can I get a 3rd dose to solve this problem?
There is no recommendation for a third dose. You won't be able to get a third dose in Ontario. I think the important thing is to follow up with the cruise line on their guidance. We've certainly seen that this is something that's been worked on, tried to address. It is part of our national guidance. So yeah, I would suggest following up with the cruise line on that.
Right, absolutely. And I think this is something that we were talking about last week regarding not shopping around for other vaccines just to travel or just to cross a certain border. If you got your 2 shots, you've got your 2 shots.
Yeah, exactly.
And then Lynn asks another live question here. Lynn says, when are we going to get Novavax in Canada?
Okay, Lynn, so Novavax is what's called a protein subunit vaccine. It's actually very similar to our standard flu vaccines, where you get instead of having your body make the protein, the protein is part of the vaccine. They have to apply for Health Canada approval, which I'm not aware that they've done that so far. And then we could consider, first it has to be approved by Health Canada, and then it has to be available in Canada. So those 2 pieces have not occurred yet.
Okay, 4 more minutes here, so we're going to go back to our submitted questions. Kyla asks, are they doing any studies to see if people who got the first dose of AstraZeneca and then an mRNA vaccine, are they doing studies to see if these people might need to get another mRNA vaccine?
So yes, I mean, they've done studies on this and they're continuing to follow them. The UK has a big study on this as well. So yes, they are following it. But right now it seems that the 2 doses, whatever your second dose is, whatever your first dose was and whatever your second dose was, that second dose acts as a booster to give you that higher and longer lasting protection.
Okay. And then Joanne asks, I've heard this from other people too, actually. After having my first vaccine, the following day, I developed a rash. I'm concerned about whether I should get the second shot and if I'll get the same reaction again.
Okay, so again, I would recommend that you report the rash, see your doctor, have it reported to public health, and then get guidance from your physician. And if it's an allergic rash, you could see an allergist. Usually a rash is not enough to say you can't be vaccinated again, but there may be, you'll have to look into the specifics of what reaction you had and whether there are specific guidelines, like maybe they might say take a medication before you get the vaccine or get the vaccine in this setting, that kind of thing.
Right, okay. Okay, and then that's the end of our vaccine questions for now. Let's squeeze in a couple of non-vaccine questions here. Alexa asks, is it possible to have COVID while still having your sense of taste and smell?
Yes, so it is. So losing your sense of taste and smell, if you have that, it's very indicative of COVID, but not everyone gets that. It is a more rare symptom to occur. And so you can have COVID with just a runny nose, headache, not feeling well, and that could still be COVID. So you cannot just rely on losing your sense of taste or smell.
Okay, okay. And then another question here from Marlena. Marlena is a regular contributor. They ask, in an ER department, are potential COVID positive patients near other patients in the waiting room, or are they quickly isolated if COVID is suspected?
Yeah, so when patients come in, they are screened and then triaged. And if they have symptoms of COVID, first of all, everyone's wearing a mask, so that's helpful. But if they have symptoms of COVID, they are isolated to prevent any potential spread to others.
Right.
That being said, I mean, there are people who have no symptoms, right? Which is why we all have to take our precautions and wear that mask, keep a distance, even in a ER waiting room as much as possible.
Right, absolutely. So that brings us to 1 o'clock. Thank you to everybody for sticking around through the technical difficulties. Thank you, doctor, for your patience as well. And thank you to everybody that submitted for this session. We'll have the doctor back again next week, so we'll see you all next week. Thank you.
Thank you. Bye.